Hi everyone, I'm Kuan-Pin at the China Medical University in Taichung, Taiwan. Firstly, I would like to thank the organizer for inviting me to share my research to the audience of annual State of the Science Symposium. My background is a psychiatrist working with patients with depression for more than 25 years. I also lead the Mind-Body Interface Laboratory, focusing on clinical and preclinical research of depression. Being a clinician and neuroscientist, I deeply understand the huge gap between basic research to clinical application. We really need more translational scientists who work with patients to transform the research into patients' care. And I think it's why I and many colleagues founded the International Society of Nutritional Psychiatry Research, the ISNPR, in 2013, and the Taiwan branch of the TSNPR in 2015. And our goal is to promote the awareness of the research evidence and clinical application of nutritional medicine in the mainstream of psychiatry. Today, I'm going to talk about how omega-3 fatty acids interact with mind and body. This is my outline today. So I'm going to talk about the gap between research and clinical practice in depression, and the example of our research to demonstrate how to apply translational approach in omega-3 research, and present the practice guideline of omega-3 in depression. Major depressive disorder is a major global health issue, affecting 1/10 of world population, leading the cause of world disability. The advance in medicine dramatically improve patients' care. However, as a clinician, I still witness the devastating impact of this disease to the patients, their close relations, and the society at a daily basis because current treatment unmet clinical need. For example, in the largest clinical trial of depression, the study, only 27% remitted after 14-week vigorous treatments with the first-line antidepressant citalopram. And after 1 year, full label treatments with combination of choice of 10 drugs and non-drug therapy, up to 1/3 of patients still remain ill. And despite of the ineffectiveness, most patients are still mainly treated with drugs. 75% outpatients in the United States and maybe higher in Taiwan mainly take medications. So we need other safe and effective alternative for the treatment of depression. The fact that omega-3 is important in depression comes from several lines of evidence. For example, in depression, a famous epidemiological study by Professor Hebron in 1998 in Lancet showed that countries with high fish consumptions to have a lower prevalence rate of depression, implying the protective effects of omega-3. In case control study, the lower omega-3 level has been found in depressed patients. In the meta-analysis we published in Biological Psychiatry in 2010, showed that major depressive disorder patients had lower omega-3 levels of both EPA and DHA. And if we looked at the non-clinical depressed subject without clinical diagnosis, meaning more heterogeneous group, the differences seems to disappear. However, epidemiological surveys and case control studies don't provide causal effect relationship. The direct evidence from randomized control trial should be the gold standard. So in 2003, we published one of the first RCT to support omega-3's antidepressant effects. And in 2007, we published the first meta-analysis in Journal of Clinical Psychiatry to further support the clinical application of omega-3 fatty acids in depression. In 2012, we updated the meta-analysis in molecular psychiatry, and we found that the antidepressant effects is mainly from EPA, but not DHA. And for your information, that EPA and DHA are two major components of omega-3 fatty acids, with EPA being more anti-inflammatory and DHA being more neuroprotective. And to our surprise, the antidepressant effects from EPA is consistently reported by several independent groups. Therefore, we started to think about personalized treatment of using omega-3, especially EPA, in inflammation-related depression. Here is a very interesting example. In 2016, in molecular psychiatry, Mishran and Rappaport stratified major depressive disorder patients with inflammatory markers, and they successfully increased the treatment effect size by using EPA in depressed patients with high inflammation status. The researchers' hypothesis here is based on omega-3's reverse effect of inflammation. Their finding is exciting because they prove that specific biomarkers may potentially push omega-3 fatty acids as the first-line treatment in certain patient groups. In fact, the idea of using omega-3 in inflammation-related depression has been supported in a series of our previous studies about interferon alpha-induced depression. Since 2006, we have been working with patients receiving interferon alpha therapy when it was still the only standard treatment for chronic hepatitis C viral infection. As the incidence of interferon alpha-induced depression is very high, some clinicians consider drug prevention. However, it's not clinically applicable to expose patients, especially most of the patients who don't develop depression, to unnecessary medications. In 2010, we published the lower omega-3 blood levels and specific phospholipase A2 and COX-2 genotype to be a risk for interferon alpha-induced depression. We saw that omega-3 is well tolerated as compared to drug. Therefore, we conducted the first placebo-controlled double-blind clinical trial to test the prevention effect of omega-3 EPA in interferon alpha-induced depression. There you can see in the right that EPA is the most effective to reduce the risk, while both EPA and DHA delayed the onset time of depression. Our study not only provides the important clinical possibility to change the treatment and prevention, but also confirms the notion that anti-inflammatory strategies are effective antidepressants in the context of depression associated with inflammation. To summarize our work and others' work, I propose two applications about how to personalize the use of omega-3 in depression. Firstly, the biological specificity. We demonstrate that omega-3 is effective in inflammation-related depression, such as interferon alpha-induced depression and cardiovascular diseases. We are now conducting trials in chronic pains and obesity. We also applied preclinical models to investigate molecular mechanisms. Another application is safety consideration. We apply omega-3 in children, adolescents, pregnant women who are more sensitive to drug side effects, or to prevent high-risk population to avoid unnecessary exposure to medication. To help the physician to use omega-3 in clinical practice, I invited the top highly cited researchers to work together in a panel of International Society of Nutritional Psychiatry Research to publish a practice guideline of omega-3 fatty acid in depression treatment. We conducted a Delphi survey and comprehensive literature review for the guideline. which is published in the Psychotherapy and Psychosomatics in 2019. This article is chosen as editor's choice with free access and provides the comprehensive information for treating depression with omega-3 fatty acid. Here I just want to present briefly how the guideline looks like. We emphasized the practice should be based on comprehensive evaluation in clinical setting, and the quality of product is very important, and we agreed on using omega-3 in specific population, including major depressive disorder during perinatal periods, and children and adolescents, and also the elderly, and the prevention in high-risk population. In this guideline, we recommended the formulation and dosage, especially EPA for major antidepressant component, and recommend pure EPA or EPA combination with the ratio of EPA to DHA more than 2. We emphasize monitoring the adverse effect. In fact, the more carefully you monitor, the more adverse effect you will find, although they are not major, they are only minor. My colleague, Dr. Jian Zhang, and I recently guest edited a special issue for the BBI, Brain Behavior Immunity, Nutrition and Immunology in Mental Health, Precision Medicine, and Integrative Approaches to Address Unmet Needs in Psychiatric Treatments. We included 15 papers discussing the role of not only omega-3, but also blueberries, melatonergic agents, cannabinoid, in the context of immunoregulation of brain behavior and immunity. From omega-3 derived mediators to many other nature and nutritional compounds, I think future research might find many promising targets to develop novel antidepressant agents. So I'd like to stop here to acknowledge the founding bodies, my collaborators, and most importantly, my lab colleagues. And thank you very much for your attention.